Good morning, everyone. This is Dr. Herzog from Implant Center of Miami. I am a board certified implantologist and I'm here to show you my day. So today we are going to have a few different things on the schedule. Like always, we have our deliveries and our uncoverings and our post-ops and our consults. Fortunately, you guys don't see any of the consults because that's all behind closed doors. But you're going to get to see some interesting surgeries. The first surgery of the morning, we're going to be doing a ridge augmentation, bilateral. So you'll see how we build bone when there isn't much bone left. So if you don't use it, you lose it. If you've been a long time without teeth, it's very possible that you don't have any or you have very little bone left in your jaw. And in those cases, in order to be an implant candidate, we have to rebuild that foundation. So today we're also going to be using platelet-rich fibrin, which is basically stem cells that allow for better healing and also for better placement of the bone graft. And I'm really excited to show you that process as well. It's something very advanced yet simple that almost every dentist, I believe, should be doing right now, but unfortunately just a few are. So you'll get to see that. We have, of course, some regular implants that we're doing, always extraction and bone graft that we're doing, and some deliveries. So it should be a pretty exciting morning, and you guys will get to see some more advanced procedures, and I look forward to it. The tricky thing about screw retain is the adjustments. There's some pressure here, okay? Don't bite yet. So you always want to check the contacts. Make sure that the contacts are there and that they're not too tight. So sometimes this can hurt a little bit because we're basically pushing the gums open so that the crown will sit into the gums and there won't be any space. So if you'd like, you can put anesthesia, but it goes away really quickly. So you don't over tighten the screw or leave it too loose. And then we cover the screw hole with something called Teflon. And this will protect the screw from the filling that I'm about to put in. I like to use the driver to put the Teflon. And Teflon is antibacterial, and that's why we use it. In the old days, we used to use cotton. And now we just cover the access hole, which is the screw hole, with resin composite. I use a flowable material, and it's light cured. It's blinking. And check the contacts again. You should hear that little snap. And now we'll check the bite. Side to side and open. Thank you. And you can see there's a spot there that's pretty high. And so we'll just adjust that down. A little bit of water. So in this procedure, what we're doing is basically once I numb the patient, She only has about 2 millimeters of bone, and I saw this in the CT scan before, so we advised her she needs a bone graft. This is called a ridge augmentation, and the procedure is technique sensitive but fairly simple to understand. So basically the gums are elevated and the space is made for the bone graft. The bone is then micro-perforated so that we can stimulate bleeding, because bleeding is what heals everything. And so we need a blood supply in order to grow the bone, okay? So once I do the micro-perforation, then I can mix the 3 types of bone graft material together and the PRF. So here we have 3 different types of materials, and we're going to add PRF. But this here is called allograft, and we've learned about that in a few other videos, and basically that is human-derived bone. Here, this whiter material we have is xenograft, and that is actually coming from a cow. And what you see here is putty, and so putty is almost like a glycerin agent that has some allograft material mixed inside of it. But what this is going to do is when I mix these together, now this is going to give me better handling on the material, so I can place the bone graft. Beautiful. With the topical. Okay, so I'm just going to get this mixed together. If you need me to move it, let me know. And so you can see now how it becomes kind of sticky and almost like a putty, so I'm able to place it where I want without the bone graft material going all over the tissue and falling out. Okay, so that is ready, and we will add some PRF to that later. And then here I have my membrane, and this is sterile. This is what I will place over the bone graft material so that gingiva or the gums don't invade the space and soften the bone graft material. So you can actually see me placing here the bone graft onto the ridge in the position that I want. Now once I have a nice and hardy ridge, then I'll slide the membrane over the bone graft, and this is a barrier membrane that won't allow the tissue to grow into the bone graft. I tuck it in on the palatal side or the lingual side, and then I suture it all together. And what I do is I use the sutures to hold the membrane in place and keep the bone graft in place. It's really important to check the patient's partial denture to make sure that it's not pushing on that area of their face, because it will flatten the bone graft material. It's also important to tell the patients not to rub or massage the area, because you want to keep that bulk in place. You don't want to flatten it out. For these procedures, sometimes I'll prescribe a steroid so that you don't have inflammation. You might have seen during the procedure, or you might see during the procedure, I am actually using a blade to release the tissue so that I can stretch that tissue over the new bone. And this is something that does cause inflammation. It causes a little bit of pain and a little bit of swelling, but if the patient is really good about putting ice and taking the steroids, then they really should have no pain or inflammation at all. So that is ridge augmentation. I try to under prep a little bit when I'm doing an immediate placement. This means that I don't use the final drill to length, or I don't use the final drill at all. And this is so that I can get good stability on that implant. Whenever you have an immediate placement, there's an area of gums that's missing because there was a tooth in place. So we have to stretch the muscle over to cover that area so that the implant isn't exposed to the mouth. And that's why sometimes you can have swelling when you do the implant the same day. In order to get primary closure, the gums need to close completely. So to do that, what I can do is I can just separate a bit of the periosteum, or the inside layer, and that will allow me to get some stretchiness in the tissue. I'm trying to put this in layman's terms, but then I can basically get that primary closure by stretching the muscle or the tissue over the extraction site and sealing it off. Hey everyone, so it was quite an interesting day. I am sorry in advance, or actually afterwards, for all of the bloody content on this episode, but some of my docs have been asking for it, so there it is. And you guys got to see some surgeries today. You know, a lot of the times the patients who are getting surgeries or implants don't want to have their faces shown, or they don't want the camera in the room at all, so I'm sure you can understand that. So we try to get some surgeries for you to watch, and in this one you got to see a few. And so in this case you got to see some implant placements, some placements in a narrow ridge. You got to see a really great surgery, which was a ridge augmentation procedure, where there was a narrow ridge that was not a candidate for an implant unless we augmented the area, and that turned out great. You know, one thing that I haven't added yet to this is kind of the before and afters on the x-rays, and that's mostly because this is really meant for patients to be watching, but I know that a lot of my doctors have been watching these episodes, and maybe I will post some of those x-rays on my Instagram. That's at Implant Instructor, so it's a little bit gory, that site, so if you're not into that, don't look at it. But maybe I'll get some of those before and after CT scans on the Implant Instructor site, so you guys can see kind of what really goes on, and understand that for all my patients out there. So if you have any questions about ridge augmentation, which is basically an advanced bone graft, or if you have questions about a simple implant surgery, you saw that some of them, they just take about 3 or 4 minutes to do if the site is nicely prepared beforehand. So even in the immediate placement, it really doesn't take much more than about 5 or 10 minutes total for the surgery. If it's taking longer than that, then maybe something's going wrong or fishy, so you might want to ask. And you shouldn't be afraid, because nothing hurts. Sometimes you'll see the patients flinching a little bit, but really it's just because maybe they're getting water in their face or they feel the vibration, but at no point does anyone feel any pain in any of these videos at all. So maybe the anesthetic injection might pinch a little bit, but it really doesn't hurt so much, and the surgeries absolutely don't hurt at all. So a lot of times you'll feel things and you'll hear things, but there is no pain involved in any of that. So don't be afraid, ask questions, you know, definitely listen to your doctors. I had a patient call up last week asking me if I did laser surgery to place implants. And, you know, laser technology is great for many things. It's great for gum surgery. It's great for gum disease. It's nice to uncover the implants. It does take a little bit longer, but, you know, there's a new laser now, the Solea, that we can do fillings with. And it has its uses, and it has its uses in the tissue. But to place an implant, we don't use laser surgery. I'm not aware of anyone who is using laser surgery to actually place an implant. So I just wanted to mention that. And you know, if you guys have any information you want to run by me that you've been told, I'd be happy to kind of go over it and educate you guys. The another question that I always answer is, do you guys do socket preservation. So that's basically extracting and placing the bone graft. If you've been watching my videos, you're very, very well educated on these things. Nowadays, with the information right in our hands, patients can, Google things, and you say, well, where'd you get that information? And they say, Dr. Google, right? So it's really important to kind of run these things by your actual doctor, because a lot of the times what you're getting might be propaganda. It might be a company trying to sell their laser, or someone trying to sell their bone graft or something like that, and it's not backed by science or practice. So those are some of the most important things you have to look for, and the best one to let you know is your implant surgeon. I hope you enjoyed this video, and I'll try to make the next one not as boring. Have a great day. This is Dr. Herzog at Implant Center of Miami.